welcome to everybody. We have our governor, Ramesh Mahalingam, and I would request him to bless us with the opening remark on this auspicious day of World Organ Donation Day, which is the need of the hour. Now, next voice is Ramesh ji.
Okay, thank you very much, Rajesh ji. First of all, I must make a disclaimer. I am no one to bless. I need blessings myself. And I will say this, I am the one to plead, to request, and to cajole and coax people into what I'm going to say. Yeah, the theme of the day, it's a very noble theme. It is really my privilege to welcome you all to this important conversation. There are so many people here. The very fact that you all have logged in to attend this session tells us something about your personality and your character, your willingness to give of yourself, not just of yourself, but a part of yourself, right? So let me begin with this very rhetorical question. Must our capacity to give end when our life ends? Most of us think of giving as something we do in our lifetime. We give our time, our knowledge, our resources, namely money and other resources, and occasionally a part of our time in the service of others. Organ donation invites us to consider a profound possibility that even when our own journey has ended, something of us may allow another person's journey to continue. Now, you may want to know, why is IBPC espousing this cause? As a member of a business council, what have we got to do with this cause? I'd say, and having been instrumental in bringing this cause to IBPC, I personally believe in it. And so with conviction, I would say, we may be a business council, but our responsibilities do not stop at commerce. We're also a community institution. We bring people together with the reach and influence that IBPC has for creating awareness, for encouraging informed dialogue, and to advance the causes of genuine public value. Organ donation concerns families across nationalities, across professions, and across social backgrounds. It is therefore a cause that speaks directly to our shared humanity. This is the beauty of this cause, and no better place than UAE, with all its close to 200 nationalities, to be espousing this cause. I get it. This is not an easy subject to discuss. It requires us to speak about our own mortality, which most of us would rather postpone. It's the same thing that happens with life insurance or with writing wills. And then you have another dimension, that of religious or cultural questions. You have uncertainties about the medical process, or at its very simplest, a lack of reliable information. And so what do? We simply say to ourselves that this conversation can wait. But then, does our silence or our procrastination, does it make the question disappear? No, it merely transfers the decision to our families, who may then be asked to consider it at the most difficult and emotionally overwhelming moment of their lives. As business leaders, we understand the importance of planning, documenting our intentions, and preparing for contingencies. We do this not because we expect the worst, but because clarity protects those who must carry matters forward. Surely, our personal wishes deserve the same clarity. This evening is not intended to pressure anyone into making an immediate decision. It is intended to replace uncertainty with understanding. The distinguished speakers we have invited to speak today will explain the mission, the medical process, the facts, and the common misconceptions. And I'm keenly looking forward to the personal perspectives that some of our speakers will bring from their personal lives and infuse meaning to this organ donation aspect quite vividly to life. I will leave you with one simple request before our esteemed invitees come to speak. When you return home tonight, please have this conversation. Ask your family what they know, what they believe, and what concerns them. Seek reliable guidance, discuss your values, and arrive at an informed decision together. This decision is not an individual's decision alone. It is to be had as a family. This much I can tell you from experience, from the experience gained last year when some of the speakers who are going to speak today spoke at the forum, IBPC forum, right? And if that decision is to become an organ donor, please register. And equally important, ensure that your family knows and understands your wishes, because giving life after your life actually begins with a conversation among the living. Let that conversation begin at home tonight. Thank you all, and I look forward to a wonderful seminar. Over to you, Rajesh.
Thank you, Rameshji. Thank you very much for explaining in brief the value of gift of life. You have also taken the family aspect, which is very, very important in this journey. All the participants, please note that this particular session, we have a very, very eminent speaker. And since IBPC belongs to Indian community and we all live in UAE, so it is our privilege that we connect UAE to India and India to UAE. We have a very, very important person today, a very Dr. Maria Gomez. She's from MOHAN, that ministry. She's a director of NRCDT at the UAE Ministry of Health and Prevention. She brings 26 years of global experience in organ donation and transplantation journey. She has worked with leading organizations including the Donation and Transplantation Institute, Barcelona, and Outcomes Australia. As a former National Transplant Director of Colombia, she helped to achieve 60% improvement in outcomes over 3 years. She advises the WHO and the Pan American Health Organization and serves on the International Society for Organ Donation and Procurement, leading its educational working group. What I have known about her, she is an encyclopedia for this organ donation journey. I have met him a number of times, and today we all are going to get benefited out of her experience. I request Maria to please enlighten this journey, how organ donation is important, what is the value in UAE, and how we can be part of it. Over to Maria.
Thank you very much. Good evening, everyone, and thank you for that lovely introduction, Dr. Rajesh. First of all, I have to say thank you to all the leaders of IBPC for inviting Hayat and for offering today to talk about this noble cause, because I do believe that what we will talk today during the following hour is about an act of generosity. So giving life or leaving a legacy here in the country, in the world, through organ donation is the highest act of generosity that a human can do to other human. This is what we will talk about, how we will give our legacy, we will leave our legacy here in this world when it's our time to move forward. So I will share my slides. I have few slides, but this is maybe an invitation for maybe to do a dialogue, and then if there is questions or comments, feel free to stop me, and we can freely, friendly, have this conversation. Can you see my slides? Just to be sure that I'm presenting.
Yes, we can.
Okay, good. So yes, the purpose of this presentation is to present to you about what is happening regarding organ donation and transplantation in UAE, and especially provide like the keys of, we have to say, the success of the UAE model in organ donation. But before we go to the law, the regulatory framework, and the structure, of course, and the data, because we will also review some worldwide data. What we are talking about when we're talking about organ donation, of course, we are explaining that is the possibility that any of us we have in order to donate our organs. There are two types of donors. There are living donors and deceased donors. So living donors is referring when myself, during my life, I decide to donate one of my organs, regularly is kidney or part of my liver. I decide to donate my kidney, for example, to my loved one, any of my relatives, or also I can donate to one friend. So this is called unrelated donation. So now in UAE, we have regulated relative donation to my family members, or unrelated donation to any of the friends or person in needs. This is living donation, only possible for kidney and liver, mainly. There are some literature about maybe segments of the lung, but this is less often happening. Then we move to deceased donation, and then the figures that you have here is combining disease and living donation. You can see here, this is from the World Health Organization. There is something called Global Observatory for Donation and Transplantation, and then you can see here that between kidney, which is the highest number of transplant happening worldwide, also here in UAE, is the highest number of transplant for kidney, liver following, of course, and then heart, lung, pancreas, and small bowel. About 150,000 transplant. 150,000 transplant has been performed every year worldwide. But the most important is what is stated in the left of the slide, which is this cover only 10% of the global needs. So over 90%, 90% of the global organ transplant needs remain unmet, which means people who will die, or people who are waiting for an organ for transplant and will die. So I was explaining about living, now I have to explain about disease. This combines all type of transplant. What is disease transplantation or disease donation? So when I die, because I already pledged, I am a donor. So when I die, I will donate all my organs. And of course, it's the only way we can donate heart, pancreas, small bowel, and of course lung. So from one person who decide and who pledge or who consent to donate all the organs, we know that we can save the life of 8 people. From one, we can save the life of 8 people. And then there is the pledges for organ donation. What is that? Is myself, during my life, I take the decision to pledge as an organ donor. And then I register. I registered in Spain, in the registry, or in UAE. I am already registered as a donor. When I die, I know that I want to be a donor. But then one powerful statistic and studies demonstrate that less than 1% of the people who pledge, less than 1%, and this is very important, of the people who pledge finally become a donor. You know that there is a lot of myth, and we are here to talk about this myth. If I pledge or if I register as a donor, then probably I will die tomorrow, or something will happen with me. Less than 1% of the people who register or who pledge as an organ donor finally become a donor. So what else? World Health Organization, here in this next slide, established, you can see here a warm up. Dark blue is the countries with the highest donation activity, And of course, the light blue, we are talking about 40 donors per million of population. This is how we measure donation, in donors per million of population. So it doesn't matter the size of the country. Countries, small countries like UAE with 11 million of population, or Portugal, we can compare with huge countries like India, China, or US, if we measure as a rate, donors per million of population. So the highest activity in the world, like, as you can see here in the dark blue, is coming from Spain and from USA. They are about 40 donors per million of population. Last year, near to 50 donors per million of population. Last year, UAE achieved 14 donors per million of population, but we will see in the journey how in 2017, we just started 9 years back, there were no donation at all. So 9 years back, there were no organ donation, and of course, as you can see in the slide, no organ donor, no organ transplant. And then this slide, and I will go back for you to, again, to see here the dark blue, and then you can see here in the map, the dark orange, because this is about kidney transplant. Countries with dark blue, of course, they have dark orange. If there is donation, there is the possibility to offer to the patient transplantation. And on the left, you have the resolution from the World Health Organization, and the formula is very simple. It's already established. World Health Organization defined that the model or the system of organ donation has to be integrated to the healthcare system. So all hospitals, all healthcare facilities should develop and implement their disease organ donation programs inside of critical care units. In UAE, we have 90 hospitals that they are already supporting disease organ donation, and we have nine transplant facilities, 9 hospitals that they have been licensed for organ transplant. This is the journey. As I mentioned to you, only in 2017 it was possible to perform the first disease organ donor and the first disease organ transplant. This is heart transplant actually, but transplantation are happening in UAE since 1985 from living donors. Then from the first disease organ donor, there has been a journey where UAE grows very fast, from 3 donors in 2017 to 149 donors last year, on total more than 500 donors and more than 1,500 transplant recipients. This is people who receive an opportunity to recover their life. What else? The law. What the law say in UAE? This is very important, especially to highlight that Hayat program is overseen but also run by the Ministry of Health, by the government. This is not an NGO. This is not a private or public healthcare facility. It's directly the Ministry of Health and Prevention who are running and overseeing the program. So you can, the one who are interested, we can facilitate the law. 2 pillars in our law. Organ donation is a right in UAE. Anyone can exercise the right to donate or not. And universal access to transplantation. So anyone in UAE, resident in UAE, regardless nationality, socioeconomical status, and belief on waiting list, they have to have the right to receive an organ through the organ allocation. Of course, there are more subjects in the law that you can see here: international collaboration, how we support donor families and related donation, living donation, health insurance. Health insurance are mandated to cover donation, but also transplantation. And we have many more policies I just listed and copy here, just to explain you how well regulated is the program in UAE. So not only national, federal, but also by Emirates. So Abu Dhabi, Dubai, Sharjah, Northern Emirates, EHS, also the health providers, the healthcare providers. How is our governance and our structure in UAE? We have our National Committee for Organ Transplant, where all the local health authorities and regulators, they have a seat, as well as the main transplant facilities. Then we have the National Center, which is has two roles, is the operational arm, but also is the responsible to audit and to supervise the system. We have the organ donation organization, which has doctors and nurses who run the program. And of course, we have the different local health authorities as well. The key, and I'm almost finished, the key characteristics or the key, let's say, criteria of our model is that it's an unified approach, federal and local authorities, is endorsed by the government, and there is trust in the system. There is absolutely trust and confidence because of, as I mentioned before, is run by the health authorities. I always say the things happen because of people. Of course, we talk about law, we talk about governance and structure, but we did, at the end of the day, what we are here, all the members of the IBPC is powerful people with a good heart that they want to know more how to help their society. So we have the same. You can see here our people. They are doctors and nurses. At the right side, you have them. Actually, Dr. Nak is here in the middle. They are ICU doctors and nurses who take care about the process inside of the hospital. And on the left, you have all the staff of the National Center. Then going to the end, the data, this is the rank for organ donation. You saw before from the World Health Organization as a map, but here you can see the journey of UAE. So how in 2020 we will almost with no activity, and how we have been growing exponentially. So last year, this is not updated, the rate, as I mentioned to you, was 14 donors per million of population. Right now, UAE is above some European countries like Germany or Hungary. And if we only talk about the donation activity by Emirates, Dubai last year was 20 donors per million of population, that this is even above of countries like UK. As a final remark, maybe just to highlight, we have, as I mentioned to you, a unified and a collaborative approach with a unified agency and different local health authorities. We have our hospitals with a strong structure and doctors and nurses working for that. We have our legislation or regulatory framework that we have this unified determination of death plus many more standards how to operate. And then what is the future? We have our mandate of healthcare insurance to cover and then provide this universal access. Anyone, everybody resident in UAE, if there is a need to receive an organ, they will have the right to receive that organ. And of course, the dream is to expand this to all other GCC countries. Right now, we have a collaboration with Kuwait and also with Saudi. We are organs that we don't have compatible recipients here in UAE. We share with Saudi and Kuwait. They don't have a liver transplant program. They don't have heart and lung as UAE have. So we transplant patients from Kuwait, or we included in our waiting list. I think this is the last slide. So this QR code is to invite all of you to register and pledge for Hayat, or Hayat is live in Arabic. So this is what we are saying we are doing. When we pledge for Hayat, we are pledging to give the best gift that a human can offer, which is give life. Thank you very much.
Thank you, Maria, very much. Thank you. You have enlightened the subject in the most informative way in a very, very simple language so that all the viewers could understand the importance of organ donation as well as the law which is prevailing in UAE. And I am just requesting all the viewers, I am sure that they may be having many questions and many thoughts. They can write in the chat box. So before the end of the session, we will take it up and we can clarify all the questions. This is a request to everybody. Now we have Dr. Nag is here. Dr. Nag?
He texts me and he's trying to connect because his signal is very poor, but he's trying. If he connects,
Okay.
I will let you know, Dr. Rajesh. Thank you.
Okay. Okay. Thank you, Maria. Thank you. Meanwhile, we have a very, very important person from Mohan Foundation, India. Her name is Lalitha, and she is very passionate about the organ donation. Lalitha Raghuram, she is a country director of Mohan Foundation with 40 years experience in advocacy, education, and community development. Lalitha ji works span organ donation, eye care, and community development, including leadership role with leading healthcare organization. She has dedicated her career to promote organ donation awareness and supporting families. Her personal and family journey with organ donation inspired a Bollywood film, Aaye Zindagi. I would request everybody to watch this film. I have personally watched this film. It's a fantastic film, and that is based on her own family life. Her contributions have earned several honors, including CNN, IBN, Real Heroes Awards, Ashoka Fellowship, and Jivan Shakti Awards, and so many other awards. She is totally dedicated for this cause, and every time we speak to her, she gives a solution to the problem. Today, we are lucky enough that Lalitha ji is here, and she will share her journey, her task, and the importance of this very, very noble cause to all of us. Lalitha ji, thank you for joining us. Over to you. Please enlighten us. Thank you very
Sure.
much.
Thank you. Thank you, Rajesh ji. This is my 5th presentation today on the World Organ Donation Day. I had 3 TV interviews, 1 presentation to a hospital management association, and then the 5th one to all of you. Thank you so much for inviting me. May I have my slides, please, Manju? Like Rajesh ji said, I work for Mohan Foundation as its country director. Mohan is not anyone's name. Mohan is an acronym for Multi-Organ Hope and Advocacy Network. We are a 30-year-old organization. We started our work in Chennai, and now we are working in 14 locations. I'm based in Hyderabad, but right now in Bangalore. I have come for some official work. So we are a non-profit organization, and I will present to you about organ donation, the myths and facts, and also about what the situation is in India. Next slide, please. Next slide, please.
Suganya.
Suganya. So what is organ donation? Organ donation is donating healthy organs from one person, either living or deceased, to a patient who is badly in need of that organ out of true will. Every word in this slide, in this sentence, is very, very important. You are donating, not selling or buying. Healthy organs, you can only donate if our organs are healthy. So we have to stay healthy to be able to donate organs from one person, either living. There are some organs that can be donated when a person is alive, like we are born with 2 kidneys, so we can donate a kidney. We can donate a part of the liver, and we can donate part of lungs. So these are the organs that can be donated while we are alive. And when we are deceased, when we are no more, when we are leaving this world, there are several organs and tissues that can be donated. And this is given to a patient that is waiting, that is suffering end-stage organ failure, and we are donating out of true will. There is no coercion, there is no force here. So all of this happens. I think my slides haven't changed, right? Yeah. So there is absolutely no coercion, no force. It's absolutely voluntary. Like Mr. Skandan said, go back to your family, think about it. There is absolutely no force here. This has to be done out of true will. Everyone that is associated with this cause has to feel the pride that, they are doing something good to the society. Instead of burning or burying the body, you are donating organs. So it's such an important thing. You are actually playing God. God is nowhere. God is in us. Because when we are leaving this world, we are able to give a new lease of life to at least 8 people. So that is the power of organ donation. Next slide, please. So we all know about tsunami. In 2004, we had tsunami in India, in Asia, in Southeast Asia, and in East Africa. Can you please click on that? About 2.5 lakh people, that is 250,000 people were lost. There were casualties in tsunami. Next slide, please. Similarly, end-stage organ failure is also like a silent tsunami. Next slide, please. So there are about 5 lakh people waiting for different organs in India, 500,000 people. About 2 lakh people are waiting for kidneys, about 2 lakh for liver, and 50,000 for heart, and about 50,000 for lungs. Especially after COVID, there are a lot of patients that are waiting for lungs and they require a lung transplant as soon as possible. And these are patients that, if they don't get an organ within the next 3 months or 6 months, they will die while on the waiting list. While this is the case, how many transplants did we do in India into 2024? We've done only about 13,476 kidney transplants, about 4,900 liver and 253 heart, and about 100 lungs. And you will be surprised to know that a majority of them, 82% of these organs have come from living donors. Either a family member or an unrelated donor has donated. Only 18% of them have come from the deceased donors. So when you look at, Maria mentioned about the organ donation rate globally and also in the US, the leading country is Spain, 40 per million population donate organs. In India, it is 0.8 per million population. It's not even 1 per million population. That is the situation in our country. And that is the reason there is a great need for everyone to know about organ donation. And that's why we are talking about this cause, which is a very, very important one. And similar to what Maria mentioned, we also have a law in India, which is called the Transplantation of Human Organs Act, which was passed in the year 1994. And why was this act passed? One, to prevent commercial dealings. No organ can be bought or sold. And also to ensure that brainstem death declaration is legalized and to pave the way for brainstem death patients to be able to donate organs, for the families to consent to donate organs. So these are the 3 objectives of the Transplantation of Human Organs Act. Even after 32 years, you can see what the situation is in our country. Next slide, please. So moving on, when can a person donate? Maria mentioned that when we are alive, we can donate, or when we are deceased also, we can donate. When we are alive, a near relative, for example, if I have a kidney problem, my blood group is A positive, somebody from my family can donate 1 kidney to me. If I don't have any family member to donate, next second degree relatives can donate, like a mama or a chacha or a mommy or a cousin or a nephew or even a friend or a colleague taking pity with my situation, they can donate organs. As far as the deceased donation is concerned, there are 2 types of deceased donors. When we talk about deceased, all of us know that when the heart stops beating, the person is deceased. When the heart and the pulse stops, that means a person is deceased. But the Transplantation of Human Organs Act has made it possible to declare brainstem death. What is brainstem death? We will talk in the next few slides. May I have the next slide, please? So as far as can you please click? As far as near relative is concerned, Who are these near relatives? Parents, siblings, spouse. Although spouse is not a blood relative because he or she is emotionally attached, they are in the near relative category. Children, grandparents, and grandchildren can donate. Other than near relatives, anyone by reason of affection and attachment can donate, but this has to be authorized by the state government. Health being a state subject, this has to be authorized by the state government only if they approve that there is no commercial dealing and the donor is donating purely out of love and affection and the recipient is not paying anything to the donor, then they will give approval and the patient can go ahead and undergo a transplant. Next slide, please. Now we will look at what are the organs and tissues that can be donated when a person is alive. All of us know about blood donation. A person can donate bone marrow, one kidney, portion of the liver, portion of the lung, portion of the pancreas, and uterus also can be donated. But the most common ones are the four: the blood, bone marrow, the kidney, and also the portion of the liver. Next slide, please. Tissue donation after circulatory death. When the heart stops beating, which is very common, all of us know about it, our eyes can be donated. Our eyes can be donated within 6 to 8 hours of death. Eye donation is very common in India. Last year, we have had 60,000 eyes as donation. So in the south of India, there is no waiting list for corneal transplant. Anyone that wants to undergo a corneal transplant can walk into a hospital and undergo a corneal transplant because eye donation has become very popular. Similarly, heart valves can be donated. Skin can be donated. Especially for burns victims, skin can be donated. Bones and tendons, cartilage, veins, these are not common, but the first three are very common. Organs also, solid organs also can be donated after cardiac death or circulatory death, but we are not going to talk about it today because it's not common in India. In the Western world, it is common, but in India, it is not yet very common. Next slide, please. So we are talking about brainstem death now. What is brainstem death? Before we talk about brainstem death, let me talk about what the brain does. I'm seeing you, I'm looking at the monitor, I'm wearing glasses, I'm wearing white blouse. So all of this I'm able to do. I'm speaking to you, I'm sitting, my blood pressure is controlled. Everything is happening because my brain is functioning. How is my brain functioning? Our brain is like the hard disk or the CPU of a computer. That is where everything is processed. So the brain receives oxygen-rich blood continuously. Even when we are asleep, the oxygen-rich blood is supplied to the brain. But when there is an accident or there is an intracerebral bleed, we call it brain hemorrhage, some people become brainstem dead. Their brain completely stops functioning, especially after a head injury following a road traffic accident. In India, especially, 70% of our donors are road traffic accident victims. Unfortunately, they don't wear a helmet. So they are road traffic accident victims, and most of them are between the age of 20 and 45. Imagine young people become organ donors because they don't protect their head. So this is brainstem death. Next, can you please click on that? So brainstem death, can you click on that, please? So brainstem death is not coma. Please don't think that this is coma. Brainstem death is where the brainstem has completely, permanently, and irreversibly ceased to function. So brainstem death, when the brainstem death happens, you can see the normal brain and the brain death brain. You can see there is absolutely no oxygen-rich blood flow. So this normally happens after a trauma or an intracerebral hemorrhage. Like I said, majority of our organ donors are road traffic accident victims. And these patients, you will not find them in the old age home. We get a lot of calls saying, old age home mein hai, we want to donate organs. In such cases, we cannot donate solid organs, but corneas can be donated, eyes can be donated. These patients you will find only in the intensive care unit on the ventilator with extensive medicational support. So this is something that all of you should know. And brainstem death certification, according to law, Everything is specified in the law. The Transplantation of Human Organs Act is our Bible. So 4 doctors have to declare brain death, and they have to do it twice at an interval of 6 hours in the case of adults. In the case of children, between 12 to 24 hours. It may vary with age to age, but this is mandatory. There's a form that needs to be filled. Everything is, as per law. So there is absolutely no room for any scam or scandal here. So now, which are the organs and tissues that can be donated after brainstem death? Corneas, kidneys, liver, heart, lungs, pancreas, hand can also be donated. These are the commonest organs and tissues that are donated in India. Of course, there are several other organs and tissues that are donated. Look at this magic. Can you please keep clicking? Look at this magic. Keep clicking. Two eyes can be donated. Lungs can be donated. Heart can be donated. Liver can be donated. Small bowel can be donated. Pancreas can be donated. And kidneys can be donated. One donation, many lives. That is the power of organ donation. So we can, a deceased donor, a brainstem donor can give a new lease of life to at least 8 people. What are we doing? We are simply burning or burying the body. And that's the reason it is very important that we make organ donation conversation a normal coffee table conversation. We should all do that. Because tomorrow we don't know who will need an organ. We may need an organ. Our loved ones may need an organ. Our friend may need an organ. At that time, if we don't support the organ donation movement, where are these organs going to come from? Next slide, please. So it's important. This is a story of a girl. You can see in the middle, there is a girl. Her name is Shreya Siddhanagaudar. She was doing BA in Manipal College, the Manipal University. From Pune, she was traveling to Manipal after finishing her holidays. She was traveling by bus to Manipal. The bus met with an accident and she lost both her hands. Imagine a 19-year-old girl losing both her hands. She waited for 8 months and she received a hand transplant at the Amrita Institute of Medical Sciences in Kochi. Now there are 4 centers that perform hand transplant in our country. Jipmer, Stanley, and of course, Bombay Global Hospital also does it. So there are several hand transplants also done. So it's not just the internal organs, hands are also possible to be donated. Next slide, please. So there are a lot of myths and misconceptions about organ donation. People think doctors work less if they know you are an organ donor. Doctors won't know about whether you are an organ donor or not. They work equally the same way to save your life. And organ donation will disfigure the body. No, there is absolutely no disfigurement. Organ donation retrieval is a surgical procedure. It's like an open heart surgery. And family will not be charged for donating organs according to law. Once the consent is given, there is absolutely no charge to the family. Next slide, please. This against religion to make an organ donation. All religions unanimously have endorsed organ donation as the most supreme form of gift. We have done donors for up to 85 years old also. Ultimately, the final decision whether the organ is in good condition or not will be decided by the doctors and the transplant centers. So as long as we keep our organs healthy, we can always be an organ donor. There is absolutely no way that the rich and famous can jump the waiting list. Every state has a web-based organ sharing registry. So whoever is on the top of the waiting list only gets the organ. Next slide, please. Next slide, please. Patients cannot recover from brain death. Brain death and coma are not the same. Brain death is death. Just like when the heart stops beating, when the brain stops functioning, that is brain death and that is death. No organ can be bought or sold, like I mentioned to you earlier. Next slide, please. So, like everyone mentioned, if you would like to, you can take a pledge to donate organs. When I started working with MOHAN Foundation, 25 years ago. That's the first thing I did. I pledged for organ donation. You can all do it, and you can do it online. Next slide, please. We have a QR code that has all the information. Just give all the personal details. And if you click on the submit button, you will get an automatic message that you have pledged for organ donation. You can download the donor card, laminate it like your PAN card or Aadhaar card and keep it with you. But the most important thing is, please tell your family that you would like to donate organs. In fact, everyone in the family above the age of 18 can pledge to donate organs so that eye and organ donation becomes a family tradition. Next slide, please. Next slide. Like Rajesh ji mentioned in the introduction, I'm a donor family myself. I'm a donor mother. I donated my son's organs. My son's name is Swami Narayan. He met with a tragic road accident in 2004. He was only 19. He was doing engineering in SRM College of Engineering in Chennai. He came to Hyderabad on vacation for Pongal vacation. He met with an accident. He became brain dead. And I was already working in MOHAN Foundation. It was like testing me, whether, if something happened to me or my family, if I will donate organs. I went ahead and we donated all his organs. And in fact, at that time, the President of India called me to Rashtrapati Bhavan and felicitated. That's a picture taken at that time. Next slide, please. This is my last slide. I just want to tell you that there is a beautiful movie made on my story, because the liver was received by a young man from Gwalior who is right now in Chicago. His name is Lavdodi. So a movie was made on my story. Revati, the South Indian actress, played my role as a grief counselor. And this is on YouTube, available free. There are already 2.7 million views. It's a very well-made movie. 1 hour, 40 minutes is the duration. Please go ahead and watch the movie. If you have any questions, please use the chat box and we'll be very happy to have you. And thank you so much for this opportunity.
Thank you very much, Lalitha ji. It has been really very informative session for each and everybody. And your last slide about your own journey, which most of us know about it, the sacrifice, what you have done, you have tasted the whole journey by this noble cause. Because we are running short of time, so I will immediately go to a donor. Just for the information of all the viewers, we have here one donor who has donated and one recipient who has received. They will be sharing their journey in 2 minutes. And can I request Sadhvi Sabarwal, please unmute yourself and just share your own journey about your donation to the family. Next voice is Sadhvi's.
Thank you so much. Very good evening to the esteemed house. And thank you for this forum and this platform to talk about such a sensitive issue. Thank you to Ms. Lalitha and Dr. Maria for sharing what they did. As I heard them, I could relive the journey that we went through here in Dubai, in UAE, for my mother in December 2024, when she passed away suddenly while visiting us at the age of 64, and brain death it was. Something that sums up my thoughts here: you may speak a language, I may speak one, but when the hearts connect, we all become one. Organ donation is all about connecting humanity, connecting with each other at a very intrinsic level, which starts with an intent of an individual and can only come to fruition with the support and the working of the whole system together, other than the family. So thank you to each organization, each authority that relentlessly works behind the scenes. It's never an easy decision, though my mom, Radha Kapoor, pledged her organs way back with the All India Institute of Medical Sciences in 2004, making sure my brother and I sign as witnesses. But when the time came, we had our own thoughts, And when the doctor was sharing the news about her being brain dead, she had collapsed while taking a shower. We managed to give her CPR and take her to the hospital. But when the moment comes, you are struggling with your loss, with your grief. And then it's that moment where are you able to connect grief with gratitude? When you have gratitude for the gift of life that you have, are you at that time in a position to respect the intent of the deceased and to pass on that gift of life? That is the thin line you got to walk. And once you firmly decide to walk that line, yes, there is a huge void, grief, loss, but yet there is a satisfaction for honoring what the family wanted, the individual particularly wanted, and gratitude for the support that being here in Dubai, in UAE, the Hayat program and the Ministry of Health, the way they stepped in and with utmost dignity and respect helped us carry out the last wishes of a mother who was able to donate her kidneys and liver, sorry, and save 3 lives. She knew the value of organ donation because she lived her life on one lung, and she saw the eldest sibling, her brother, pass away even after having a kidney transplant. So probably that's when something changed inside her, and at the right age, she decided to go for it. It's legacy is not something big out there. It's the small choices we make in our day-to-day lives. It's something that we are able to pass on to the next generation. It took me a while, but earlier on this year, when I signed up here, being in the UAE with the Hayat program for my organ donation, and if I may connect the dots, last week when I was at the Ministry of Health for an interaction, a googly was thrown at me when the interviewer asked me this question. Now that you have pledged your organ, my son who is only 11 right now, what if when the time comes you were to remind your son, what would you say to him? And signing up for something different, but when this question came to me and I had to move into a future scenario and say that, this is what I would want my son to remind himself, that you have been blessed with the gift of life. When the time comes, just remember to pass on that gift, to pay it forward. And that is what organ donation is all about. Yes, we
Thank you,
may
Fadliji.
have,
Thank you very much.
okay,
Thank you very
thank you
much
so much.
for explaining the whole thing. And really, I think in 2004, your mom, she made a decision, and that made your decision easy when she passed with the brainstem death in 2024. So that is the reason awareness and the pledging is most important. Now we have one recipient, Seema Nair. She will tell her journey. Seema ji, can I request you to be very short and precise in 2 minutes, please? Seema ji.
Yes, sure. Thank you very much, Mr. Rajesh. I am very fortunate to be a recipient of kidney, and I'll just tell you very shortly that I was diagnosed with renal failure in the year 2020, and that was a devastating diagnosis that I had at that moment because I was with a young family. My kids were young, and I was working here in UAE. But the entire world of mine was in UAE. At that time, there was a big question on how am I going to get an organ if I needed one, if ever. So, but thankfully, because of the work of people like Dr. Maria, who has worked very hard to implement the Hayat program in UAE, I was lucky enough to get a donor in the year 2023, and I was transplanted with a new kidney. And thankfully, I do not know who is a donor family, but because of the donor family's generosity and because of people like Ms. Sadhvi, who was out there, that even in their darkest moment, they had decided to do this, great work of donating the organs for someone. Because of people like them, I'm here still alive, and I'm, talking in such a forum here. So I'm very, very grateful to all the donors out there and the donor family who has decided to donate an organ. If they did not have the awareness, and if they did not have the grace to go ahead with this, then people like me would not have been alive to see this day and to talk about it. So I'm extremely, extremely grateful. And it's I would like to tell Ms. Sadhvi especially that with the donation, your mom has not just given life to those 3 people, but they have inspired a lot more people. For example, when I get a donor organ and I get a donation, and when people see me thriving, there are a lot more people who are interested in donating, wanting to know more about donation. So I'm so very happy that I have been
Very
invited.
nice, Seemaji, very nice. Thank you for sharing. And really, she's an example of the recipient, and we can understand how important is organ donation. Now, we have a few questions in the chat box, and I am just going to take up 1 or 2 questions because we are running very much short of time. The first question goes to Maria, that how the organs are allotted in UAE for the needy in case there is availability of the organs.
Yeah, thank you for that. I saw that there are many questions and I try to start to answer. So
Yes.
what I mentioned in the chat is there are national allocation rules. So of course we follow UAE regulation and international best practice, but the main indication is clinical compatibility and clinical criteria to allocate organs. So to give you an example of the complexity, we know that in UAE there are 4,000 patients with chronic kidney diseases, and we have 1 donor with 2 kidneys. So to whom you will allocate these 2 kidneys? This is the complexity of the allocations system. So there are clinical and medical criteria based on compatibility, like blood group, like antigen of histocompatibility, HLA, the needs to test that the person who will probably receive this kidney has not antibodies against the kidney, because otherwise it will be rejected. There are many criteria that will make, and there is a clear score that the clinicians will have in order to select the most compatible recipient and the one who will benefit for that donation. The same for heart, the same for lung. Each of the organs, they have these clinical criteria. There are one question that say, if I pledge here but I die in India, what will happen? Because I'm playing here, pledging here, or getting the donor card for organ donation. So this is why maybe the most important is explain your family, talk with your families and your relatives that your wishes, your willingness about organ donation, because it doesn't matter where that happened, when or where. You are an organ donor here, in Europe, in India. The important is, again, the act of generosity. So of course, if the person dies in India, the donation will happen in India and will benefit patients, as Lalitha already explained, the number of patients who are waiting for organ, and vice versa. If you are here, although you have the donor card here, your family has to consent. So here for UAE, your family members, even if your family members are in India, we will contact virtually for Teams or any other platform, and then your family members will have also to sign the consent.
Lalitha ji, there is a question which is very pertinent to you. India is a big country with rich and poor people. So if the same question is whether the rich people will get the priority in getting the organ in case they need.
Just like Maria said, in India also, in all the states, we have a web-based organ sharing registry. We do have a scoring system, how long they have been on dialysis for kidneys, and for liver also we have a MELD score, and for heart and lungs also we have different scores. So whoever is on the top of the waiting list, only they will get an organ. In fact, the donor family or even the donor hospital will not know where the organs will go, because there is a state authority appointed by the government of India. So there is a national body called NOTO, National Organ and Tissue Transplant Organization in Delhi. And under NOTO, we have SOTO, State Organ and Tissue Transplant Organization. Every state has a SOTO. They are the ones that maintain the web-based registry, and there is a nodal officer for SOTOs, and they will see whoever is on the top of the waiting list, only they will get an organ. There is no way that, the rich and famous can jump the waiting list. Everything is absolutely transparent, and I can tell you we have not had any scandals and all so far.
Thank you very much, Lalitha ji. I have many questions, but I believe that we are running out of time. We have our Secretary General Sahitya ji Chaturvedi. I would like to request him to give his comment on whatever we have heard and people have talked. Sahit ji, over to Sahit ji, please.
Thank you. Good evening to all. The comments, if I start, it will be a long journey because it cannot be summarized. Is one part is the responsibility, the other part is the accountability, then the another chapter goes to the inspiration. So, but I can definitely say that as we come to close this meaningful session today, and particularly on the World Organ Donation Day, I would like to express my sincere gratitude to all our distinguished speakers, experts, donor, recipient, representatives, and every participant who joined us today. More particularly, today's discussion has reminded us that organ donation is not merely a medical act. In fact, it is an act of humanity, compassion, and the hopes. A decision taken by one single individual can give another person a second chance of life and bring a new ray of hope to the entire family. At IBPC, we want to acknowledge and we strongly believe that CSR is not only about contribution, it is about creating sustainable social impact and building a cultural responsibility. Organ donation is a powerful example of how an individual, business, and the communities can come together for a cause that transcends the borders. On behalf of IBPC, I once again thank all the speakers, Dr. Manju, the convener of CSR Forum, Dr. Rajesh Agarwal, so well moderating the session, the CSR Forum team, and all the participants for making this initiative so meaningful. And with respect of time, I take the pause here.
Thank you, Sahit ji, for your wonderful observation. There is a saying called, that is from the MOHAN Foundation, organs are needed in earth, don't take it to heaven. What a nice proverb. Organs are needed in earth, don't take it to heaven. Finally, I would like our convener, Manju Menon, to say a few words to thank everybody. Manju Menon, over to you.
Thank you, Rajesh ji. And I think I cannot gather, enough words to thank each one of you who have chosen to be here today, sharing your experiences, sharing your journey, sharing your, motivation behind such an important cause. And I would probably start thanking Ramesh ji to begin with, in terms of explaining and describing the context of why IBPC is a right platform to have these conversations beyond the conversations around commerce and business that we usually do. Thank you, Rajesh ji, for moderating this discussion very well. You are a you have much experience in this domain, and that's very well understood in terms of how you are able to spin together these conversations. My special gratitude goes to Dr. Maria, and Dr. Nag is also here. Unfortunately, he could not join the conversation because he's traveling abroad at the moment. But we've been having these conversations with both of them in terms of how the Hayat registry in UAE and the initiatives have been very prominent in terms of building a trusted platform for people who are willing to be part of this cause. And thank you, Dr. Maria, for explaining very well and giving that confidence to the audience today as to how transparent these systems are. And we don't need to worry about those things. It's just a decision that we need to take at the end of the day. Thanks for bringing that out. Ms. Lalitha, again, what you shared with us is not just those facts that we need to know, but also the inspiration that you brought into the room, sharing, walking the talk, as we say, right? In terms of sharing your experience of being a donor family and the experience of through Mohan Foundation helping a vast number of people in terms of this process as they've been going through in India. Very inspired, and thank you for joining us. It's late in India right now, but I'm sure it's been a long day for you. But still, thanks for joining us and being part of this conversation. I think that there are no words to thank Seema and Sadhvi here, because I think you are the most powerful people in the room. After Lalitha ji, in terms of inspiring us with the kind of courage that we need to take such decisions, right? So as Ramesh ji was mentioning in the beginning, some of these decisions get procrastinated due to various reasons, right? So I think the account that you shared with us today kind of breaks those procrastination, and hopefully many of us, when we go back today, will have the courage to have those conversations with our family members. So thank you, Seema and Sadhvi, for joining us and sharing your account with all of us. And and very well summed up by our own Sahitya ji. And each one of you, I know it is the evening, and we intentionally kept this session in the evening, thinking that it will allow each one of us to come out of our usual business discussions and be part of something very different, and maybe share this discussion and have this discussion or listen to this conversation when you are along with your family. And that was the intent of keeping it at 6:30. But thank you for joining us, and I hope you will have a lot more courage and intend to have this conversation with your families after today. So we intend to keep these conversations going on at at IBPC, and we look forward to your support, your enthusiasm, and your encouragement in taking it forward. And Lalitha, Maria, we are going to come back to you again and again for more support in taking this initiative forward. And a big thanks to our dear Uma. I don't know if she's still there, because she's somewhere in the South India, somewhere in the hills of South India right now, but she is the one who has helped us put everything together. So without her support, I don't think me or Rajesh, she would have been able to, put everything together so easily. And the IBPC team here, who is behind the curtains, but managing everything from the logistics to invitation. So thank you, each one of you, for being here and for your encouragement and your support. And a very good evening to all of you. Thank you.
Thank you very much, Manjuji. And everything has to be concluded. So I must thank everybody, and we will see each other again very soon. Till then, namaskar.
Thank you. Thank you. And Jai Hind.
Thank you.
Jai
Thank
Hind.
you.
Thank you.
And in
Bye-bye.
advance,
Bye-bye.
happy Independence Day.
Thank you.
Jai Hind, and thank you again.